Hello everyone. Welcome to the webinar. Hope you all are doing well and safe. I'm Akansha Sahai, Project Manager at Rehab India office, and we are a Madison-based startup with the mission to help patients and families struggling with addiction and mental health by connecting them to the right rehabilitation center. So we act as a bridge between them, and currently we are working with around 1,700 rehabilitation centers in India. And in today's webinar, we will be discussing rehabilitation for addiction and mental health, facts and myths. And our guest speaker is Dr. Rohit Garg from Abhasa Rehabilitation Centre. And we have Raj Nandani from our team, the Rehab part team, who is a psychologist and is a part of our team. And she'll be driving the rest of the conversation for today's webinar. So this is going to be a one-hour session. So please feel free to drop your questions anytime on our Facebook or Zoom page, and we will be taking them at the end of the session. Over to you, Raj Nandani. Thank you.
Thank you. Thank you for the introduction, Akansha. All right. Welcome, Dr. Rohit. Before we get into the questions, why don't you just introduce yourself to our audience first?
There isn't much of introduction here. So I am Dr. Rohit Garg, and I'm a psychiatrist. I practice in Delhi, and I've done my graduation from BJ Medical College, Pune, and then I was in King George Medical University, Lucknow, and then I was in All India Institute of Medical Sciences, Delhi, where I did my senior residency in psychiatry. And we have been dealing or taking care of mental health issues and dealing with psychological and psychiatric issues at a private level for almost 12 to 13 years now. And I've worked in more than 8 states in the country at the moment, seen more than 60 to 70,000 patients on charity basis, done a lot of camps around. Our work has been awarded, acknowledged, not only on national platforms, but also international platforms. One of them being, at the House of Lords, London, where our rural, rural initiatives that we took in terms of addiction, because I basically belong to Punjab, and how Punjab was gripped in, when it comes to addiction. So a lot of youth and everybody. So we did a lot of work there. So that is what it is, and I'm very passionate about my work in psychiatry, and that's what I would just want to say about me.
Okay. I think you started off saying that there's not much, but I can say that your experience and all of your background is going to make this conversation very interesting. You have been working with Abhasa, so could you tell us a little bit about Abhasa and what its approach to recovery is?
So see, the first thing is that, why this term called Abhasa. So Abhasa in general means, your constant exercise, working on yourself constantly. That's what Abhasa means in Sanskrit, right? So what I believe in is that anything and everything in life needs constant exercise. You need to keep working on things constantly. Let it be your physical health, mental health, your body, your, whatever you want to achieve. You want to crack any exams, you want to do anything. What matters is that how consistently are you working on it? And that's what we believe in. So when it comes to addiction, when it comes to rehabilitation, when it comes to mental health issues, I believe recovery is almost a lifelong process. Like, the learning is lifelong process. You keep on learning forever in your life. And that's what I believe in, that you need to keep improving on yourself for the rest of your life. You need to constantly keep working on yourself. There's always a scope to be better. So that's how the concept of Abhasa came in. And, we also saw that there is a lack of passion, there is a lack of compassion, there is a lack of understanding about the problems. And when many people would just go and stay at one point, most of them were treated in a similar fashion. They all went through one program, but the need of a person, of an individual, could be different from another person, right? If there are 20 people living at one place, doesn't mean that they all will benefit from the same program. Mm-hmm. So what we thought of was that, why not to individualize the programs for better benefits or more benefits, I would say. So that's how the concept of Abhasa came in, and the founder, is Gayatri. But I came in as a medical consultant, as a doctor on board, where we just guided them through the process, that in terms of the medical field and other things, how things could be done in a better way for people. So the first center was started in Coimbatore, which has been doing really good. It has shown very good results with people. And obviously, there is nothing that we can say 100% ever anywhere in the world. But relatively, people have been doing good, and it has brought a significant change and difference in the lives of people. So that's how the concept of Abhasa came in, to do things differently with much more passion.
Okay, yeah, that makes sense. Like when I first heard the name Abhasa, I was intrigued to think like what does that really mean? But now I understand. So speaking about Abhasa, could you tell us what the basic treatment plans there are like?
So see, like I said right now, so basically, the first thing is that what I want to tell people is what actually rehabilitation means. I mean, then you can think about the plan. So usually, a word rehabilitation in itself has got a lot of stigma attached to it. If you tell somebody that you have to go to a rehab or you have to go for rehabilitation, he or she thinks, oh, what is this? Like, do I need this? That kind of a thought process comes in. In fact, if anybody is going to any of the naturopathy centers like Jindal's, or any centers, yoga centers like Ramdev's, or whatever centers, to lose weight, that is also a part of the rehabilitation. So rehabilitation means basically, to get the best out of you. Rehabilitation means to take yourself to the best possible capability or abilities that you can do and perform and live in the world, and sink in with society, to come over your limitations. That is what rehabilitation means. A person who has gone through stroke, a person who has gone through a knee transplant, a person who has just delivered a baby, they all need rehabilitation basically. So rehabilitation doesn't only mean that stigma in terms of mental health, or just an addiction kind of a thing. So rehabilitation means uniting with the society back again in the best possible way, right? So with that concept of rehabilitation, we have developed various programs at all our centers. I'm also a part of other door of a concept which is Door of Hope in Delhi. So there also we developed a similar kind of a concept. So when it comes to rehabilitation, we thought of why not to individualize it, why not to start working on the basics, why not to take all these things into consideration, that finally they have to go back to society, they have to go back to their home, and they have to start living a natural life which they would want to. Or until and unless we don't give them that exposure within these confined areas, it can be sometimes difficult for a person to get back to the normal atmosphere, I mean, which is back home, and behave in a similar in a better way. So for example, somebody is taking alcohol or any kind of a substance. Now when he's in a rehab, and he's admitted inside, he's in a confined or a restricted area, so we don't see any kind of that behavior. But as soon as he moves out, he might start getting those cravings back again. So what we did, in not only the indoor programs which are done at most of the centers, like sessions and counseling and psychotherapies and exercises and yoga and meditation, we also introduced outside programs, like people would go for picnics, people would go for hiking, people were taken for small treks. Because of the COVID, there were a lot of restrictions. We could not do that. But earlier, they were taken for horse riding. They were taken for, to the riverside, and just taking a dip in the river kind of a thing, simple activities. So people could feel normal, people could feel in control of their emotions and addictions even outside the rehabilitation home. So the most of the programs, they were designed in a way where they can get exposure to the outside world while they are living inside, while they are being in a restricted area, and which could give them a better understanding of their self, and which could give us better results. And it did bring a difference. It did make a difference in their results.
Okay.
Yeah.
So, like you said, that Abhasa believes in having individualized programs rather than making everyone fit in the same program, right? And like you also said that people are given more liberty so that there's more holistic development rather than just restricting them on certain rules. So these are some things that make Abhasa unique. And this was kind of my next question. What makes Abhasa different from other centers? Is there anything else that you'd like to add to that?
See, the one thing which is done over there is that there is a lot of human contact over there. There's a lot of uh, talking that happens among the therapists, counselors, and people who are staying there. There's a lot of compassion that these people show. There are a lot of things that they do in terms of also family counseling, because see, it's not only the person who is over there who is responsible for that situation. Even the family members need to be explained in detail about the situation that the person is going through, or the disease or the disorder that he's going through, because finally when he goes back home, there are a lot of behaviors which can trigger the relapse. So a high level of importance is also given to the family members in terms of psycho-educating them regarding the problem, how to deal, what to do, what not to do. And if that is missed out, the chances of relapse are high. The another unique thing is that in most of the centers, rehabilitation centers, basically for addiction, the baseline behavioral issues or emotions or psychiatric disorders are not looked at. Let us say the person is having alcohol addiction. So when he goes to the rehabilitation home, they are only focusing on alcohol. But they don't see the baseline problem, which is depression, anxiety, or anger issues, or personality issues. And until and unless we don't treat those issues, it becomes really difficult to treat the consequences, which is alcohol usage. So a strong importance is given for the overall assessment of a person, where the person is in detail assessed and diagnosed on or assessed on various platforms of personality, of psychiatric disorders, and other things. Like we have had a case where a person came from Goa. He was admitted in a rehab for about a year for cannabis addiction, but when he came to us, we saw that he's suffering from psychosis. It's not cannabis. His main problem is schizophrenia. So once he was treated for schizophrenia, his cannabis stopped, right? So hitting the right point, the nail, that also becomes important when it comes to addiction and other things. So a strong importance is given to the complete overall psychiatric assessment and treating those associated comorbidities or disorders which are going on along with addiction. So that makes it, the results very, very different. Yeah.
Right. Okay. So rather than just treating the symptoms, we're looking at what the root cause is and any other factors that are contributing to the addiction. Right.
Yes.
And I really like the community kind of a feeling that's there. Like you said, there is a lot of bonding between people in Abhasa. So I want to ask where Abhasa is located, but you already mentioned it's in Coimbatore. So are you planning on expanding in any other cities in India?
See, I believe that rehabilitation in general is one area where there is a complete lack of awareness, complete lack of facilities. It's a sector which is totally unexplored. It is a sector which people don't know about, and it is also a sector where the needs are not met at the moment. right? So with the current situation that is going on, and the kind of stress, the kind of substance abuse, the kind of things which people are suffering from, I'm sure that the mental health issues or problems are going to increase, and there is a need for better centers which can do a better job and give better results. So we are starting with a new place which is in Mumbai, which is Karjat. So Karjat is a beautiful place which is very close to Mumbai, Lonavala, Pune, Nasik, and it's got small hills around. It has got maybe more than 50 activities over there, outdoor activities that one can do. You can do trekking, you can go to the waterfalls, you can go to the dams. There is a film city nearby, exposure to the big city. So there is like I said, that it is not about confining a person to a place. It's about exploring other, things in life. I don't know if somebody is with us and we take him for a trek and, he gets obsessed about it and that becomes his obsession rather than drinking being his obsession. So there is a lot of place for organic farming there. We are even planning for, in-house organic food, even having our own, animals in terms of cows or those kind of things where they can get an experience of organic food, plus they can be involved in various activities. So there's a Chinese garden over there with all the possible vegetables and all, because people have to finally find out their own passion. They have to find out what interests them. So we are starting in Mumbai, and then we also plan to, obviously expand things around, and with the main aim being, providing facilities to every section of society, basically. It cannot be, because in general, a good rehabilitation center or a good rehab is an expensive affair, to be very truthful. It is expensive. And since people may have to be admitted few times before they completely get out of it, so we do have our expansion plans where we are going to provide services to all sections of society. And just to add, even at Abhasa right now, we have taken care of a lot of people who have not been able to afford things. So we have subsidized their treatment plans. And at another place, which is Door of Hope in Delhi, which I'm associated with, we have a person staying with us for almost 4 years, and we have been taking care of his food and clothes and everything. So Abhasa is not about only catering to people who can afford, but it is also, about people who really need help. And if somebody is deserving, then his treatment plan or treatment costs are subsidized. So that again can be added to the point that how is Abhasa different from other people, right? Yeah.
Okay, yeah, that sounds really good. So has the center already started, or is it going to start?
So before, because of the lockdown, there were some delays, but it's starting from the first week of October now. And it's a very beautiful location. It's very peaceful over there. I don't mind staying there for the rest of my life and spending and having some good time there, because there are a lot of birds there. There's a lot of, trees around, and there's the environment is so nice and pollution free that by evening 5 or 6 o'clock, I mean, you don't need ACs, and you may not even need fans and all those things. So it's right on a cliff of a hill. So I'm sure the environment, makes a difference. It helps in the recovery of people. If you like the place, and it has got all the basic facilities in terms of activities, in terms of, we are trying to provide Ayurvedic natural massage therapies over there. There are sports activities. The dining area is facing the, valley. I mean, it just feels good to sip a cup of tea sitting and looking at greenery, looking into the valley. So I'm sure. So by the first week of October, we are going to start, and hopefully we'll be doing some good work there.
Right, absolutely. It just gives you like a break from all the daily stresses in life and just brings you closer to nature, right? And
Yeah,
I think that is going to be beneficial for anyone. So it's going to be rehabilitation for anyone who stays there, honestly.
yeah. That's true. That is absolutely true.
All right. So coming to the topic of our webinar, how about we talk about some of the myths and debunk those?
Yeah. See,
Sure.
yeah, you want to say something?
Yeah, I was just going to talk about the myths. Is there
Yeah,
something that?
yeah. Please go ahead.
Okay. So the first myth I have here is addiction cannot be cured and is a moral problem. That's something that people commonly believe. So what is your say on that?
So, see, addiction is not just a behavioral problem. It has been time and again proven, science has proven that it is a disease. Okay. It has got a genetic component attached to it. It means that if one member in your family has got addiction issues, then your other family members, like your children or your brothers or sisters, they are also prone or at risk of having addiction. It's just like one member in the family having diabetes, then you are more prone to have diabetes, or similarly as it goes with cancer or hypertension or any other disease. So addiction in general has been proven to be a disease. Okay, it's not just a behavior, but yes, that is how people or society looks at it. He cannot quit, he doesn't want to quit, he doesn't want to leave, and all those kind of things, and that's how they start treating him also. They start thinking that he cannot get better and he doesn't want to get better. But the truth is that even if the person wants to get better, it becomes difficult because of those biological and chemical changes in the brain. So there is something called as reward circuit in the brain. So as soon as the person who is suffering from addiction sees that substance, so it starts clicking over there. It leads to that craving, and that dopamine release further adds on to him taking substance. So it has been time and again explained that it is a disease. Obviously, along with that, there are a lot of personality and behavioral issues, and it is not just a thing to do with morality or ethics or anything else. Yeah.
Yeah, this kind of reminds me how in the very popular movie Tare Zameen Par, it
Yeah.
was about dyslexia and how his father had very difficulty comprehending what the disease was. He just
Mhm.
thought that the child is just being lazy and being arrogant.
Yeah.
The
So
same
it's just like that.
Yeah, it's the same attitude that people have towards addiction as well.
Yeah.
And another popular thing that people believe is that only certain people can have addiction, like people from a certain sector, maybe a particular gender or a socioeconomic strata. So what do
Mhm.
you think about that?
So see, like any disease, like you can have a 4-year-old child who has diabetes, neonatal diabetes. You can have a person of 20-year age old person suffering from hypertension. You know, addiction being a disease is not limited to any particular strata or anything, any age or gender. Like we get cases of a 12-year-old child having addiction of inhalant abuse. So they sniff inhalants basically. So we have cases of 60, 70-year-old people coming to us who are having massive problems with alcohol, nicotine, tobacco, and other things also. And these days, I mean, it's even if it's not even to do with the gender anymore, because even the women's section of the society, I mean, there is a increase in substance abuse with the women as well now. I mean, especially when it comes to smoking, alcohol, and one of the primary drugs which people are abusing these days is cannabis, right? So most of the people think it is natural, it is organic, it is being prescribed in countries like Canada and America. It is herbal, it is for peace of your mind, but they don't realize that it is being used as a medicine for certain disorders, and you are not having those disorders. If it is being used for cancer, you don't have cancer, you're right. And the people don't understand that that everybody doesn't get cancer because of tobacco. Like if 100 people are smoking cigarettes, then maybe only 10 get a mouth cancer. 90 may not. So those 90 will always say it doesn't cause any harm. But similarly, we everyday cases we have cases where there are cannabis-induced psychosis, cannabis-induced personality changes, and behavioral issues. So all stratas of society, rich, poor, it is addiction is widely prevalent, and all age groups, it is widely prevalent. The average age of anybody trying any kind of a drug has dropped down to 13, 14, 15 years now in various studies. So that's the first time people are trying drugs for the first time. So you can imagine that, how fast and how quickly it is growing. So it's wrong to think that it is more in the lower strata or of society and all. I mean, the biggest, the richest of people have been suffering. I mean, not to name, but we all know that few celebrities come down to alcohol addiction. So that's how prevalent it is.
Right. Yeah. It makes sense that addiction does not discriminate between people.
Yeah. That's how it is.
So people also believe that not just with addiction, but also with mental health, that only when they hit rock bottom, after everything is completely ruined, do they have to go out and seek help and, go to a rehabilitation center. Is that correct? Or when is the right time to seek help?
See, any problem, if treated at the right time, will obviously give you better results, So, I mean, the concept of rehabilitation, most of them think that rehabilitation is only to do with chronic problems. Aisa nahi hai. It's not true. So rehabilitation is also to do with acute problems, right? So for example, anybody had, an episode of psychosis or an episode of panic because of the substance abuse or those kind of things. So he needs acute help then and there. Okay. So one doesn't have to hit a rock bottom to start working on self, but unfortunately that's what is happening in the society. Like I told you, that there's a strong stigma associated with rehabilitation. I mean, the family members tell us themselves, how can we send our child or our family members to a rehab? How will he live without us? How can we live without him? What will other people think? What we will tell to the other family members or, society, ke hamara bachcha kahan gaya hai, and all those kind of things. That is what people talk about. So unfortunately, they do it as the last resort. Believe me, 90% of the calls that we get are SOS calls, like emergency calls. I wish it was the opposite, that emergency calls were maybe 10% and 90% were acting in time. So when you hit a rock bottom, obviously, the situation is much more chronic, much more difficult. There are different variables to it. The prognosis becomes poor. आप किसी भी बीमारी को पकड़ लो, you don't go to a hospital when you are having a heart attack if you know that you got high BP. I mean, one needs to start working on his high BP or high cholesterol before he has a heart attack, or before he's about to have a heart attack. So that's how it is. I mean, when somebody is pregnant, I mean, she's following up with the doctor on a regular basis, right? That okay, and that is how the better outcome comes. I mean, if a lady visits a doctor with pregnancy at the last stage, there can be a lot of complications. So one needs to keep working from the day one. So please do not wait for your family members to hit a rock bottom and then take a call. And I would also advise people to not let that happen to themselves, because they can have a better life. Because by the time they hit rock bottom, they have lost a lot of time of their life. They have lost a lot of respect. They have lost a lot of finances. They have lost a lot of their family members and relationships, which are the most valuable to us in our lives. It becomes sometimes difficult to come out of it. And even if you come out of it, the trauma is quite severe.
Right. Yeah. So it's best to seek help. The sooner the better.
The sooner the better. And one needs to, I mean, everybody knows, I mean, you and me know that, okay, this is a problem. But
Yeah.
so why don't we go? I mean, leave apart addiction. If anybody has got a tooth problem, he doesn't go to a doctor until it pains him and keeps him awake throughout the night. They
Yeah.
only go to a doctor when the toothache doesn't let him sleep.
Right.
And addiction being a much more chronic problem or any mental health issues, I would tell, I mean, if I have a problem, I would say, okay, let me just go to a place where I can be away from my stressors, my family, people, chill out, calm down myself, and then come back on my own, back again. Why it should be waited till the time it hits the rock bottom?
Mm.
See, life is limited, right? There's a limited fuel that we all have,
Yeah.
right? So why not get the best out of it? Why should I start working on myself when I am 120 kgs? Why can't I start working on myself when I'm 88 and I want to be 70, right?
Right. Yeah. Okay. So there's another, I'm not sure if it's a myth or not, but maybe you can tell us. So people believe that rehabs are unaffordable and instead they can just cure themselves.
Yeah. So to be very truthful, good rehabilitation center needs a lot of facilities. Okay. So it needs a doctor, it needs a lot of psychologists, it needs the basic infrastructure, it needs good facilities in terms of food and other lodging and other things. So it adds up to a cost. So, and in the government sector, there are not many that are available, you know. So it comes at a cost for sure. There are a lot of rehabilitation centers which are running at a lower cost. They may not be able to give you the best of the facilities in terms of maybe food or lodging or those kind of things. But at the end, what I believe in is whatever helps, you know, so one should seek help. My only advice would be that always go to a rehabilitation home or a center which has got an associated doctor or a psychologist or a clinical team attached to that center, you know, because there are a lot of centers which are just more of a detention centers, which are more of that people are admitted there, but their main issues are not handled. I mean, people do talk about addiction and all those things to them, but there is no other work that is being done. So I would advise to seek help from a center which has got at least one doctor or a psychologist associated with that center. So there are very few in number who, you know, who are less expensive, I would say. The average cost of a rehabilitation home, what a good rehabilitation home, what should be there? I think it should start somewhere from 60, 80, 70, 90,000 a month to, it can go up to like, there are, you know, there's no limit to it basically. I mean, there's a different concepts coming of luxury rehabs and all those kind of things, though, which I fail to understand at the moment. But ऐसा नहीं है कि there are no facilities. ऐसा नहीं है कि people can't afford it, because there are facilities which are affordable. It's more to do with the you know, willingness. So जैसे IQ होता है ना, वैसे ही WQ होता है, willing quotient. तो इंटेलिजेंट क्वेश्चन होता है, जैसे इंटेलिजेंस क्वेश्चन होता है वैसे विलिंग क्वेश्चन, उनका विलिंग क्वेश्चन बहुत लो होता है, दे आर नॉट विलिंग टू डू इट बेसिकली. सो your that addiction mind or your that will always find out certain excuses. It is costly, it is this, it is that. They don't realize that the amount of money that they have spent on the substance is much more than that. The amount of money that they have wasted and they could have earned out of a good healthy life is much more than that, you know. So overall impact of the treatment is very good, and the one can, you know, get back to life. And the overall impact of the illness, you know, financially is huge if one looks at it. You know, one cigarette today costs about 15 to 20 rupees, and nobody calculates that he's spending 2 to 3 4,000 rupees monthly on a cigarette, on his cigarettes, right? So which in total makes a huge amount.
Right.
And rehabilitation is a limited time process. I mean, though it's like I said, it's a lifelong recovery, but at least you can start with it. So overall, you know, it's definitely going to be beneficial for a person. You know, if he's able to quit the substance, And like I said, we are also planning to bring up places and centers which are doing a equally good job in terms of clinical work with a much better affordability. And that's our dream, that we are able to cater the needs of people, to the needs of people.
Okay. I hope that that can happen soon. But I think that's the thing that people don't realize. Instead of investing in rehabilitation, they tend to invest in their own addiction and ruin their health even more.
Absolutely.
So my next part of the myth was, can people treat addiction on their own rather than going to a rehabilitation center?
See, I think I believe in that I think all of us need at least one person to catch hold of our hand and make us walk. Okay. I mean, Tendulkar has been a known cricketer, but he also had a coach, right? So if you have to learn, you go to school, you need a teacher, right? So similarly, what I believe is that, person in addiction reaches a point where he cannot think rationally or logically beyond a point. So it becomes really, really difficult for him to cure himself or take him out of that zone. So he would at least need one person to pull him out of that thing. So there are these organizations which are called AA, Alcoholic Anonymous, and NA, Narcotic Anonymous. And I strongly believe in them. And this is the community which is available all across the world. So there are a lot of volunteers who have recovered, who are, in sobriety for more than 20 years. And they are doing work without any charges. They're helping people without any expense or a cost attached to it. So even if somebody wants to do it or has an intention to do it, and he just has to go onto Google and get in touch with the local AA, Alcoholic Anonymous community, and start attending things over there. And I'm sure that he will not have one person, but he'll have 10% to hold him and take him forward and take him out of that situation. So it's very difficult for a person to come out of, and that is again a myth. कि मैं ठीक कर लूंगा, I will be able to quit it. I don't want to quit it. When I want, I can quit. I mean, people come and tell us examples like, कि सर जब नवरात्रे होते हैं तो 10 दिन हम पीते नहीं हैं. We don't drink when it is Navratras 10 days and I can quit like this. But at the end, they are waiting on the 11th day. They are waiting for the 11th day कि कब खत्म होंगे, and when can I hold back to my drink. So that is the situation. So I don't think person should do it alone or can do it alone. We all need somebody to guide us in this journey. It could be anybody. It could be, I think if I think more deep into it, it could be a temple, it could be a statue, it could be anything, but we will need something.
I think people can, start with something rather than nothing. So that would be better. Try, see what works for them and then go ahead.
Yeah.
So another popular belief is that one has to be religious for rehabilitation to work for them. Is that true?
So this is a wrong concept which people have, right? So even when they have classes like surrender to that higher power and all, it is that higher power has got nothing to do with religion or God. That higher power is surrender to your own self, surrender to your honesty, surrendering to your mentors, surrendering to your, that weakness of not being able to control your disease. That is what we call as that higher power. It has got nothing to do with any particular God or religion or anything. I mean, to the extent that that wherever we have our centers or I'm associated with it, most of them do not have any kind of that picture of a particular religion related god or goddesses. They just believe in that truth is God, basically. Truth is the religion. So honesty is the religion. So that's what that's the concept that we believe in. So that higher power here does not mean God. It means that to surrender to your own self, to the honesty, to those kind of things. So it has got nothing to do with religion. And I mean, see, you can see that various religions, I mean, promote substance abuse, and various religions say, one should not, like in Sikhism, if anybody is smoking a cigarette, it is considered to be very bad. But alcohol is socially acceptable, over there. And so, but all kind of things are happening and going on. But when it comes to the rehabilitation or treatment, it is not, it does not have any kind of religion or religious practices attached to it. One has a free will, and it's a general clinically, clinically organized program, clinically proven program, which can help people to come out of it.
Mhm. Right. Yeah, I think it is the higher power, the idea of looking forward to something better, which is often mistaken for something religious.
Yeah.
Okay, yeah, that definitely clears it. So another myth, or I'm not sure, is that rehabs are very restrictive and will force you to quit cold turkey. Is that true?
So the concept is that in general, any substance is better left that way. You have to go cold turkey in general. In general, okay. So there is nothing called as "dheere dheere chhod dunga," slowly I will quit, because once you have entered that stage of addiction or dependence, if you are trying to think that you can have it once in a while or you can control it, it's like really, really difficult. It's almost next to impossible. So whenever you come to a rehabilitation home, obviously, no drugs, no alcohol is provided to them. But at the same time, the withdrawals are prevented with the help of proper medication. Okay, so there are medications to substitute, those things and cover up the withdrawals, which are slowly tapered off, which are safe to be used. So, I mean, it doesn't matter if anybody comes to me with 1 bottle of alcohol or 3 bottles of alcohol. Believe me, he will sleep like a baby on the day one, right? So most of the people say, I can't sleep. I tell them, if that's the reason, let me put you to sleep. Are you ready to quit alcohol? That is what we tell them. So cold turkey means just stopping it, but with the help of the medicines. You cannot do that cold turkey thing back at home without the help of the medicines. You cannot do that because it will lead to severe withdrawals. One can have delirium, one can have seizure attacks and all those things. Yeah, when it comes to nicotine or tobacco, so a lot of rehabs allow the use of tobacco in terms of smoking. And some of the rehabs do not allow even that, and they replace it with nicotine patches or nicotine gums, So they give that nicotine gums in terms of tobacco uses. But most of the rehabs allow, limited smoking, and then we urge them to quit smoking over a period of time. I mean, when they are with us, because tobacco addiction is the biggest addiction. I mean, it's very difficult to get over tobacco. And it has got heavy withdrawals. So you either replace it with nicotine gums or other things, or you allow them to have cigarettes, which slowly you motivate them to cut down and bring them down. And further, a lot of people, they take up that call that, okay, we just want to get off it. So that's how we do it.
I think people are often scared of withdrawal symptoms, whatever their experiences might have been. And they often develop this idea that they cannot ever quit, which is why I think people are often scared.
So that's what happens is because that's what they try to do at home. Like I said, on one night I had a lot of drinks, and next day I was unwell, and I've been drinking for the last 5 years, and I suddenly mera emotions jaag jata, and I say I will never drink now, and you get into that emotional state and you have heavy withdrawals, and then you relapse, and then you start thinking, oh, I can never quit, So if you are given proper medical support with the help of medication, believe me, it doesn't matter what is the quantity of substance. I mean, we have had people consuming 200 pills a day, medical addictions. We have had people who have consumed more than 4,000 milligrams of gabapentin medication, and various kind of medical, people start abusing drugs and all. So they do not have any problems. There are no withdrawals if proper medication and support system is given. And it becomes as smooth as having an ice cream. So it just melts. It's that easy actually. So nobody should be scared of that. And if given a support system, it's absolutely safe.
Okay, that makes sense.
At least
So,
it is safer than consuming alcohol or other drugs.
mhm. Okay. A part of the myth was that people believe that rehabilitation centers are very, very restrictive, and they'll always be watched over what they're doing, and their lives will be very restricted. So how much of that is true?
See, definitely. I mean, there are restrictions in terms of movements, in terms of routine, in terms of discipline. Yeah, in terms of I think not being allowed to use internet or those kind of facilities. But why that is there is because one needs to focus and not get distracted. One needs to focus on the recovery. And I also said that there are individual programs also. For example, if there is somebody who's got a job and he wants to quit substances, alcohol on his own, and he comes to us, but he can do his online work from home and all those things. So we do provide all the facilities to him, so that he can continue working as well and he can recover also. So like I said, that there are individual programs that can be built around. Like there are people from our rehabs who go on weekends to their homes to spend weekends with their home. There are people with us who are staying with us. Their parents come and they take them once a week, twice a week for lunch or dinner, or then they come back. So restrictions are not in terms of restricting them physically or those kind of things, but it is in terms of bringing a discipline, getting up in time, getting into the routine, getting involved in all the activities and all those kind of things. It is like a house where you have all the facilities. You cannot step out of the house, but you can work on yourself with all the basic things inside. And when the right time comes, and as you're doing better, they all go out. You can meet your parents, and there are regular family meetings that are done. There's another myth is that once people are in the rehab, I mean, a lot of rehabs don't allow family members to meet. But when it comes to us, we want equal engagement of the families with our patients. In fact, we also allow family members to come and stay with them in the rehab so that they can actually see it, feel it, and they can also learn and work on themselves. I mean, most of the rehabs don't allow any family members to stay, but we have a different concept that family. And in fact, there is a team member with us, Mr. Vineet. He gets very angry with if family members are not participating. Yeah, I mean, he wants everybody to get involved into things. So we don't restrict on those things to that extent. We want things to be open, but sometimes because of certain psychiatric issues, we have to put certain restrictions, especially if the person is violent, if the person is having any self-harm, suicidal thoughts, or those kind of things. Then we have to just keep little restrictions. Otherwise, ऐसा कुछ नहीं होता.
Okay. So the only restrictions are for the safety and better recovery of the patients.
Yes. I've lived in a hostel for 17 years. I was allowed to go out of the hostel only once a month for 2 hours. I mean, I did not have any phone and those kind of things over there. I mean, what was it for? So for my betterment. That's how I look at it.
Right. Yeah. For you to be able to focus on what you're really there for.
Yes.
Another belief, myth or fact, is that if someone treats their own mental health condition, their addiction will also get better. I think you also gave us one example of how one psychotic schizophrenia case and the mental health disorder was addiction also.
Because both the things go hand in hand. So if it's like mind and body. So if you have addiction issues, you will definitely have an unhealthy mind, or there are going to be a lot of behavioral issues, And if you have unhealthy mind, then you are more at risk of consuming a substance. Why? Because there is a hormone in the body which is called as cortisol. So as soon as there is stress, So cortisol increases, and cortisol increase leads to more cravings. So we have often seen people, smoking more under stress, drinking more under stress, shopping, eating more under stress, what we call as stress eating. So cravings increase when you are under stress, and there are certain disorders like bipolar and, manias, where anyways the risk taking behavior of the person increases, right?
Right.
So he doesn't think logically. So he's like the king of the world, kind of a thing. And he does anything and everything. So there are no restrictions. So mental health issues will definitely, add on to the burden of or use of substance more. A lot of people take it, कि मुझे नींद नहीं आ रही है, I am not able to sleep. A lot of people take it. You know why people take alcohol? Because they cannot go to a party and interact with new people. So they take 2 drinks before going to the party. That, oh, I'm going to be fine. It will ease me out. So I should take that and go and talk to the people. Why don't you work on your anxiety? Why can't we work on a basic thing like anxiety and not take off help of alcohol? And that's how you keep adding on to your drinks, and finally you become addicted. So I believe that mental health needs to be worked upon along with the addiction part.
Makes sense. Yeah. People often use it as an unhealthy coping mechanism, like you said. Yeah. So my question more of is, can solely treating mental health issues treat addiction issues as well?
No, I think we need to work at both the ends. It's like 2 ends. If one is walking, it's going to take a lot of time to reach here. If both of you start walking, then you meet each other at the center point much more quickly. So I think both the things need to be addressed at the same time. You cannot even say कि पहले इसको बाद में उसको, right? They both need to be addressed at the same time. I mean, we cannot treat hypertension, blood pressure pehle and diabetes baad mein. You can't do that, because high blood pressure will increase diabetes and diabetes will increase high blood pressure. So we need to take both the things at the same time, and that is what is going to give us the best possible results.
Right. Yeah. I think in a way, both of them are like cause and consequences of each other. So unless they're both together, it's going to be more difficult.
One thing which I want to tell people here, because I'm on this platform and I'm sure some people might be watching it. But see, if you ask 100 people that how do you imagine a rehabilitation center or home, you know what they're going to tell? What they have seen in movies. The patients might be moving here like insane people, pagal ghum rahe honge, aisa ho raha hoga, waisa ho raha hoga. That is what they picturize a rehabilitation home or center to be like. But that's not true. That is not true. They imagine that people are tired, that imagine people are beaten up, this. Aisa kuch nahi hota. It's not what they have seen in movies, Movies mein to you jump from a 20-floor building and you land on the floor so smoothly like a bloody feather, right? So aisa nahi hai. So rehabilitation home is just like a home. It's like a big boss house, you can imagine, there where you're inside and you're working on yourself. Simple. It's just like that. So the concept, the picture, the imagination has to change first, I mean, I would advise, if anybody is going through it, before you think and imagine, just go and see, visit any good place.
Right. Yeah. I think media also perpetuates some of these myths in a way.
Yeah, that's where your role comes in.
Yeah, there is a lot of lack of awareness. That is. All right. So I think we have discussed the next myth to some extent, but I'd still like to talk about it. So rehab is only for people who can't quit on their own.
No, it's not like that. There are a lot of voluntary admissions. There are a lot of people, who come, on their own. They want to quit. And like I said, rehabilitation is a holistic approach. It's not only about people, or it's not only about a person who's going through that. It's also about families. It's also about other people who are associated with the person, right? So it's not only about who can't quit or who can't do this and all those things. It will always and always add to something that you don't know. It will always add to some benefits. Like I said, like 10 people will hold your hand, I mean, and take you through this journey in a much more smoother way, right? I mean, it's like pushing a vehicle on the road. If one person is pushing and 10 people are pushing, so obviously there's going to be different momentum to that. So going there is not only about people who can't quit. I mean, people who think they can. I'm sure if they get in touch with the rehabilitation programs, then there will be a lot of things that will add to their knowledge. And these small myths hinder their recovery. So when these myths are clarified and they understand those things, the recovery can be much better.
Yeah, that makes sense. All right, so let's discuss one last myth. After that, we can take a few questions from the audience.
Yeah.
So the last thing I have is people believe that rehab will not work for them a second time.
So, that relapse is very, very common when it comes to addiction. Let me make it very, very clear to people, right? So we have all heard all kinds of stories when we were children. You need to keep trying, you need to keep trying, and you need to keep trying, right? So what happens is that in the first, I would rather say it the opposite, that one should go for multiple rehabilitation attempts, to get the best out of it, rather than saying that I mean, if there is one flop in a movie, the actor doesn't stop trying another movie. If there is one flop song, doesn't mean that you don't try for another song. I would say rather go for multiple times to the rehabilitation, and focus on everything. Every time you go there, you need to work on something, you need to improve on something, right? You cannot stop going to the gym, and once you go to the gym and you build your body, and after that you stop exercising. It's a recurrent programs. I would say, even if you have recovered, always be in touch with your rehabilitation home or center or with people over there, right? I mean, it just gives you motivation. If you have recovered, why don't you just go there and help others, right? So it's not that if once, I mean, you treat cancer and after 10 years you see there is a relapse, you again treat cancer, you again go to the hospital, again take radiotherapy, right? So aisa nahi hai. I am of the opposite view. Keep working, keep going there again and again and again till the time you have overpowered that weakness of yours or that problem of yours. That's what I would say. Because after all, there is no harm. I mean, I know it's difficult to stay and not be at home. It may not be the best comfortable environment for you. There are restrictions, this. But just see how much value it is adding to life, and what are we doing back home? Nothing. We are just wasting our life when we are losing on to the most important things in our life because of the addiction.
Right.
So go again and again till you come out of it.
That reminds me of the meaning of the name Abhasa, which means practice. So it's not a quit once and you get over with it, right? It's more of a process.
Yeah, that's what it is.
Okay, so I think now we can look at some questions from the audience.
Another example is that a lot of people are suffering from infertility these days. Okay, so they go for IVF programs, in vitro fertilization, test tube babies, jisko Hindi mein kehte, common language mein kehte hain. If there is one failure in IVF, people go for second, third, fourth, fifth till the time they have a baby.
Right.
They do get results at the end. So you need to keep trying. You need to keep going until you don't achieve that.
Yeah, makes sense. All right. So I'm just going to look at what the questions are. Okay. There's one a sort of amusing question. It's asking, what if a person gets addicted to staying in a rehab?
See, I would just talk about that in case staying outside is unhealthy, in case staying outside is deadly, in case your addiction is anyways killing you, outside, it's fine to be safe. It's fine to add some value to your life and stay inside. But where this question is coming from, if I can relate to it in a right way, is that a lot of times people stay in a rehab, they go out, they relapse on the day 1 or day 2, they again come back, they go out again, and they again come back. So like so that is where they call it that he becomes addicted to the rehabilitation center. It does not make any difference to him. So he's staying nicely in the rehabilitation center. He's working on himself. As soon as he steps out, he relapses and again he comes back. So this behavior has been seen in, I would say, very, very few people, but in most of their lives, in most of them, there is always something which is undone. And most of those things are in the environment or at a family level. There is always some trigger, there is always some enabler, within the family that allows that behavior to come in and let that happen. And the basic advices which are given to them, to the patient as well as to the family by the medical team, they are not taken or they are not acted upon, right? So I would say that if it kills you outside, like Hindi movies में होता था ना, वो जब villain की मौत आती थी तो वो पुलिस थाने, मतलब he would run to the police station and ask him that put me in a lockup, I save me from people. So if it saves your life and you are able to help others and live a better quality life, I don't mind it. But if it is from that concept of getting back, and it doesn't make any difference, then there is always something which is lacking. And I would say 70 to 80% of the times it is the family that is not acting on the advice which is being given to them.
Right. Yeah. It's probably some factor that is not being addressed in the treatment. And I think there are also after rehab programs where you're transitioned from rehabilitation to normal living, and just you don't have to just immediately get back to your life. Right?
Yeah. So we do provide daycare programs also, and especially for people who have completed our programs. So we ask them to come on a daycare basis, attend to the session, help others, get involved, so that it's not a sudden transition for them. And that is how we individualize their programs also. They can come thrice a week, they can come 5 days a week, they can come once a week, those kind of things, depending on how they are doing. But most of these programs are only offered to people who are willing to work on themselves and who complete the programs. So that's how we do it. So obviously transition takes time. And like I said, it takes, overall, to completely get back to yourself, it may take 6 months to 1 year also in order to, completely get out of it. And in terms of addiction also, jab tak ek saal pura nahi ho jata, till the time you cross 1 year of sobriety, you don't think that you're out of it.
Yeah. Okay. People also spend so many years in addiction, so they should be able to spend at least, some amount of it in recovery.
Yeah, it takes a lot of time. I mean, if a behavior which is picked up over so many years will take at least few weeks or few months to go out of your system or body.
Okay. There's another question from the audience asking if one can go to rehabilitation just for depression.
Yeah, that's absolutely right. Like I said, rehabilitation is not only for addiction. Rehabilitation is for depression. Rehabilitation can be for your disturbed sleeping schedule. Like if you want to fix your schedule, rehabilitation can be for a relationship addiction. Rehabilitation could be for internet, phone, social media addiction. So rehabilitation concept means getting back to the best of your abilities, getting back into the society, and getting over that problem which you are suffering from. So there are a lot of people who do come to us on a voluntary basis, who are going through anxiety and depression and all those things. And as soon as they come, believe me, in few days they start feeling better. Why? Because there is a routine, there are people, there is a community. They discuss and they stop feeling that it's only me, because till the time they are here, they think, yeah, why is it happening only to me? Why am I the only one to go through this? So when they see and they discuss and see that, oh, there are other people too who are going through, who are fighting out, and so that automatically makes them feel better. So I mean, people go to lose weight. Like I said, that is also a part of the rehabilitation. So yes.
Yeah. So getting healthier in any way is rehabilitation.
Yes.
Question asking if Abhasa gives any discount to people below the poverty line.
100%. Yes, we do. And if there are people who are willing and who they can get in touch with the team and they can, put in their queries. And we are sure to, I'm committing this over here only that we'll definitely help them out. In fact, there are a lot of people, who come to us and we offer them, like one needs to take care of the medicines or basic tests and all those kind of things. So sometimes people even cannot afford that. So we also provide them with other solutions, okay, this is what we can do. This is what you can do, so that is what it is. So anybody who is in need, definitely to I would not say some extent, I would say to the large extent, we will accommodate them.
Okay. I'm just seeing some other questions. All right. There's another question asking, does Abhasa treat gambling and internet addiction as well? And if yes, how is the treatment different from drug addiction? Have you had any cases?
See, most of these addictions fall on the same spectrum. Okay. So 80 to 90% of the people who have gambling or gaming addictions or gambling addictions, they are also suffering from a problem which is called obsessive compulsive disorder or anxiety disorder. So which is not addressed ever, So we look into those things, the basic personality and the problem which I'm calling it to be obsessive compulsive disorder. That things get stuck into their head, that in spite of knowing that they don't have to do it, they keep doing it again and again and again. And then later on, they feel guilty about it. So gambling addictions and any kind of internet addictions in general are not different conceptually, from any other addiction, but the treatment line would differ medically, clinically it would differ. They would need a different kind of therapy or protocols. And their medical help will not be of those medicines which deal with other drugs, but their medical help will be more in terms of better control over their emotions and thinking and thought process. So anybody who has asked that question to us, please check in detail if that person has got anything to do with obsessive compulsive disorder. And you will see that there's a high possibility of having that. Once you treat that, I'm sure things will be better.
All right. Okay. So I think we're almost out of time. Would you like to take one last question?
Yeah, sure. Why not? We can take one last question.
I think you mentioned that family members can stay with the patient. So there's a question asking, how long can a family member stay with the patient?
See, most of the family members, have certain reservations in terms of their ward being sent to a rehabilitation home. So they have a lot of queries. Will he be taken care of properly? Will he be attended to properly? Safety issues, especially when it comes to women or girls, right? So family members, usually they come and stay with us. And as soon as they see that their patient is comfortable, they are comfortable. So they leave on their own. Usually they stay with us for a week or 2 weeks kind of a thing. But if somebody wants to stay for long, he's more than welcome, until and unless it is interfering in the recovery of the patient. Because a lot of times there are cases in psychiatry where patients seek attention of family members. They behave or they do things when the family members are around. So until and unless it is that kind of a condition, the family members are more than welcome to stay as long as the patient stays. How does that matter? See, at the end, the interest is the recovery of a patient. Family members or neighbors or friends, whosoever wants to stay, they're more than welcome. Right?
Right. All right. Okay. I think there are a few more questions, but I think we're already.
They can send it to us on social media platforms or over the emails, or they can search for Abhasa online, or they can search for Dr. Rohit Garg online on Google, and they can post their queries with us on Abhasa or my clinic social media page, which is Mind Vriksha. So it's Mind Vriksha. So they can do it over there.
All right. Okay. So thank you so much, Dr. Garg. I think this conversation has been very, very informative. So over to you, Akansha. You can conclude it.
Thank you so much, Rajnandini. Thank you so much, Dr. Rohit and Rajnandani, for such an insightful session. It was very informative, and I'm sure it will help a lot of people in our network, especially like people will be able to know more about in depth about what actually goes around inside the rehabilitation center. So before we conclude, Dr. Rohit, do you have any message for the audience as a psychiatrist?
See, the only message that I give to people these days is, please vaccinate yourself against stigma for mental health or rehabilitation. So people have been vaccinating themselves for corona, right? But I would advise them and I would request them to vaccinate themselves for mental stigma or stigma related to mental health or rehabilitation. And please help yourself and help others, and don't feel shy or don't feel, I'm a normal looking human being, man. I mean, at a time back, there was a time when people would think, oh, how do psychiatrists look? How are centers and this and that. I mean, so we can have beautiful interactions and we can have a road to recovery, right? And I think stigma needs to be removed. Take that thing out of your head. That's the breaker. That's what you need to get over with.
Thank you so much, Dr. Rohit. Thank you once again for the whole session, and Rajnandani, thank you once again, and thank you so much to our audience as well for such an interactive session. And we will be back soon with another webinar. Until then, stay safe and take care. Bye, everyone.
Thank you so much for bringing me here and allowing me to share my views on the platform. Maybe different on certain things, but overall, thank you so much, guys.
Thank you so much. Thank you so much. Bye, everyone.